I'm Dr. Saad Zemmouri from Casablanca, Kingdom of Morocco. I'm working as a periodontist in a private practice and also as associate teacher in several universities like Rabat universities like Paris and also in Dubai and United States as visiting professor in USC. And I work a lot on the field of periodontology and especially the treatment of the gum disease and the bone. And I did a very great study for studying the rate of the prevalence of the juvenile periodontitis, which is very great early in life oral infection, and it's caused generally infection of the gum and the bone, and also a loss of bone, a demineralization of the bone, and the mobility of the teeth and the loss of the teeth very early. And this study is very interesting because the survey has been done around a number of population of patients, around 2,421, with a backup of 18 years old, 18 years of practice, and we saw that the infection was caused by bacteria, which is Actinobacillus actinomycete comitans, and this bacteria touch generally the young people, very young, at 14, 18, and until 22, 24. And the problem is the less, very early in the life, of the tooth, and the less of the smile. And as you can understand very easy, that the smile is very important because it's the first thing we see in the face with the look, and it's linked to the look. We tell it's a beautiful smile, and the smile is the first way of communication. Don't we tell that the babies smile to the angel in first, and after to their mother, to their father. And when the young people lost their smile, they lost also the self-esteem, and it's a very interesting needs and demand, and for the fulfillment and in the society, because the smile is the way of a communication, social communication, family communication, love communication, friendship, and also professional. And the thing is, this innovation in this study is that we found that the rates in Morocco is very high. Morocco is the country where the rate of, in the bibliography, it is mentioned in the bibliography that Morocco is the country where the rate of the prevalence of juvenile periodontitis is high, is more than 27%. And the other countries where we find this kind of infection are in Arab countries, Mediterranean countries, and especially China and Taiwan. That's why, because it touches a very great population, we try, and I am seeking and reaching to find some partnership and synergy with universities, because the research in Morocco hasn't enough budget. I want, by participating in this Congress, making some synergy with great scientists, with great pharmaceutical laboratories, for trying to make research to find a treatment, anti-infection treatment or preventive treatment. Because initially the pathogenesis of this disease was understood as infection by the bacteria gram-negative, which is Actinobacillus actinomycete comitans. But the latest study done in USC University, where I did some courses there as visiting professor, to the faculty of the department, the works of Professor Nauzari and Professor Slots, who is a very great microbiologist. They found a new concept of comprehension of this disease. It's the augmentation of the cytomegalovirus in the oral floor, which cause a potentialization of the aggressivity of this bacteria Actinobacillus actinomycete comitans. That's why now we have a new way. We think it isn't just bacterial infection, but the initiation of this infection is virus. If it is virus, we can think for finding a vaccine or another things. And the other problem in this disease that because it touches a great population, it could be interesting for all the laboratories for finding something and for working both with us, with the university in Morocco, and other universities.
Thank you very much for your time.
Thank you. Thank you. I had another thing I wanted to tell you about this study. Yes, the special thing is the prevalence. The prevalence, is, as I told you, in Morocco, in this study, because now the other study that I found in the bibliography has been done and performed just at the maximum. It was a study in Dakar, in Senegal, and they had just a population of 118 clinical cases. Here it's 2,421 with 18 years of backup, and them it was just 100 with just 5 years of backup. And the rate is very high, 27%, but it touched more the female person, and the female is 67% in Morocco in this study. That's why we have also to think about a link with the hormonology of the woman, and also the biological change in the life, like the periods, like the pregnant period, and the menopause. And also we find it very often in the mother ascendants, not in the father ascendants, and in several series of sisters and brothers. That's another thing which that we have to mention because it's very important.
Anything else you'd like to add?
No, thank you so much. I hope that my work could improve the research in this kind of disease, and also to try to find synergy to share my knowledge with everyone.